Are you too fat on the inside? I want to talk to you today about visceral fat and the problems that it can cause and the difference between visceral and peripheral fat and why we need to know about visceral fat and the potential medical problems that it can lead to. First of all, humans do need fat. We need it for a variety of reasons. Fat allows us to store energy that we can access at times, though we may not see them as much here in the United States for most of us, but in times of famine or in times of poverty or in times where you find yourself in some situation stranded in the desert, which has happened to a lot of people. Fat plays a role in hormone regulation for general good health. Fat is protective in nature. For example, peripheral fat, which is different than visceral fat, is the fat that is underneath your skin. It covers our bones, our tendons, and our muscles, and it helps protect us from trauma, bumping into things, or if we have a fall. Fat can buffer us from breaking bones and injuring vessels and nerves. Now, visceral fat can be more problematic. Visceral fat is the fat that accumulates inside the abdominal cavity. It accumulates around the abdominal organs, the liver, the spleen, the kidneys, and literally not only surrounding those organs, it can actually encroach on the architecture of those various organs, and it causes disruption of normal metabolic function. And because it can cause dysfunction of metabolic processes, it can lead to insulin resistance, type 2 diabetes, heart disease, all of which increase the possibility of heart attacks and stroke, damage to the kidneys and other organs. So what does visceral fat look like? Well, you may be surprised to know that you see it all the time, but you probably just don't realize that that's what you're seeing. So when you see a man who's got a beer belly, you're seeing the external manifestation of the accumulation of visceral fat, literally pushing out on the abdominal wall. Sure, you're also seeing that peripheral fat, which is underneath the skin covering the abdomen. But often what gives men the look that they're in their 9th month of pregnancy is the accumulation of visceral fat, which literally pushes out against the abdominal wall, giving that full-term pregnancy look to men. Visceral fat accumulation occurs in women too. But one of the more concerning things about visceral fat accumulation in men and the beer belly here in America is the fact that we've generally accepted it on some level as being normal, when it's not normal at all. And in fact, it can be very dangerous to one's health. There may be genetic reasons that some people are more prone to develop more visceral fat than others, but because we live in such a high-calorie, highly processed food environment here in America, we're all at greater risk of developing more visceral fat than we ever realized. So as we head further into 2025, I think it's important to really acknowledge that this can be going on. If you've gained weight and you're not really sure why, make an appointment with your doctor if you haven't seen them in a while, and talk to them about why you may be gaining weight. Get a physical exam and get some blood work drawn if you haven't had it in a while. Now, this brings me to something else that I want to talk about, and that's the fact that even if you get blood work drawn, that's a snapshot in time. And because I'm an advocate of using continuous glucose monitors and talking to your doctor about that, because most people get blood drawn maybe once, twice a year. Those are just snapshots in time, and it really doesn't give you a clear picture of what's going on day to day, hour by hour, in terms of your overall glucose levels. In fact, most doctors have no better idea of what's going on day to day with someone's blood glucose level, unless they're monitoring someone really closely because of type 1 or type 2 diabetes. But for the most part, most doctors don't have any better idea of what's going on day to day with most of their patients' blood glucose, because they're only seeing the results of a single blood draw maybe once or twice a year. So I think it's important to ask your doctor whether a continuous glucose monitor may be appropriate in your situation. We're living in a pretty unique time in history where there are a lot of tools on the market that help us to look at various health parameters that in the past we just weren't able to do. Continuous glucose monitors, for example, give us an idea of which of the foods that we're eating raise our blood glucose and consequently are spiking our insulin. A continuous blood glucose monitor can give you an idea of how stress is affecting your blood glucose level, how sleep or lack of sleep affects your blood glucose level. I know in my own case, just getting into the car to drive to the ER, my blood glucose starts climbing, and it typically stays up higher than I would have ever expected during the course of a typical ER shift. And when I come home at night, it drops down into a more normal range. So how might you know if you're accumulating visceral fat? Well, one of the things that you can do that's inexpensive and literally can be done at home is a waist to hip ratio. Now, a waist to hip ratio ratio is simply a measurement of your waistline divided by a circumferential measurement of your hips. A waist to hip ratio over 0.95 for men and 0.80 for women are both considered unhealthy and maybe cause for concern and maybe a closer look at what's going on. Now, if you do find that you have an elevated waist to hip ratio, a few things that can be done to look at the distribution of body fat and see if you have the development of visceral fat, or either an ultrasound of the abdomen and the liver, you can get a CAT scan of the abdomen done, or in many cases you can get a DEXA scan, which looks at your distribution of not only intra-abdominal fat, but peripheral fat, your muscle mass, as well as your bone density. So what can you do if your doctor determines that you are developing an increase in visceral fat? Well, you can start with your diet. Your diet is the best place to start. Decreasing processed food intake and unnecessary carbohydrates, chips, pastas, tortillas, desserts, things like that, and really dialing in your diet to incorporate more vegetables, good proteins, fish, chicken, beef, and things like that. That's a good place to start. Make a commitment that you're going to eliminate foods that come out of a factory, foods that are highly processed and contain a lot of sugar, donuts, pasta, potato chips, things like that. These are the type of foods that your body so easily transforms into blood glucose and store as visceral fat and fat within the liver, which contributes to the development of insulin resistance. Exercise is important when it comes to dealing with visceral fat, and making sure that every day you're doing some form of cardiovascular exercise, whether that's getting out and walking for 20 to 30 minutes, but also doing strength training and focusing on developing your strength and your overall musculature. Stimulated muscles help you burn calories 24/7. And so I'm a big proponent of developing an overall exercise program that helps combat the deposition of not just peripheral body fat and also visceral fat deposition. Making sure that you get good sleep, adequate sleep, that you're sleeping as much as you need to feel rested at the end of a night. It's important because if your sleep is poor, typically speaking, it raises cortisol levels, and that increases the likelihood of the accumulation of visceral fat. Cortisol is a stress hormone, and the more stressed that you are, whether that means that you're stressed at work or you're stressed because you're not getting enough sleep or other life issues, the better you manage your stress, the lower your cortisol level will typically be, and the less likelihood that you'll accumulate visceral fat because of stress. I see people in the ER all the time who ask me, Doc, could this reason that brought them to the ER, could this be related to stress? And very often, not for everything, but I see so many patients who come to the ER and their complaints very likely do have a component of increased stress contributing to the reason that brought them to the ER. So I can't stress enough how important controlling your stress is, meditating, making sure you're putting good things in your head and listening to positive messages. It's important. Making sure that you're getting adequate sleep and that you're managing your anxiety, you're managing the amount of stress in your life. It's very important, and it contributes to your overall health. What else can you do? Consider getting some type of wearable biometric device such as a Fitbit. Now, I wear a Fitbit. I'm not being sponsored by Fitbit, and I'm not an advocate for any particular brand. But the bottom line is this particular device has allowed me to take a look at how well I'm sleeping, and how it says that I sleep throughout a given night really does tend to correlate with how I feel the next day. If I slept 6 to 7 hours throughout a given night and I didn't wake up very much, I see that reflected in the data that the Fitbit sends to my phone. And it helps me to do the things like getting ready for bed early, turning off digital devices and the TV that help me get a better night's sleep, and consequently help me to feel less stressed and feel better the next morning when I wake up. So look around. There are a lot of different brands on the market. I know Apple has the Apple Watch. I do like the Fitbit. It's pretty simple. And anyway, I like it. Not only that, it gives me an idea of how many steps that I'm getting throughout a given day and how much exercise I'm getting in on a daily basis. Listen, we've all got a lot going on. I know that most people are more stressed than they have any idea that they are. And so, making sure that you have some tools to keep track of your sleep, your exercise. Not only that, making sure that your blood pressure is good. If you don't know what your blood pressure is doing, go get it checked. Go see your doctor. That's another correlate of increased visceral fat, is increased blood pressure. And so these are things that are really important to address. So just to recap, things to focus on: measure Measure your hip to waist ratio and go see your doctor. Let them know what that looks like. Make sure that you're making good food choices, decreasing processed foods, focusing on whole foods and good protein sources, making sure that you're doing some form of cardiovascular exercise. It doesn't have to be strenuous. Getting out for a daily walk, walking for 20 to 30 minutes after each meal, if you can do that. Those are all things that help your body burn blood glucose and decrease the likelihood that you're depositing excess visceral fat. And if you are open to it, incorporating a strength training program so that you are targeting all of your major muscle groups on a regular weekly basis to make you more metabolically efficient so that you burn calories 24/7 even while you sleep. That is the benefit of stimulated strong muscle. And it's especially important as you age, because as we age, we need to be stronger to prevent the possibility of falls and injuries. And so maintaining our skeletal muscle, it's really more important than most people realize. So talk to your doctor about how to get into a strength training program. A lot of insurance programs will cover or at least contribute to some gym memberships. And so check that out, because that may be something that you have access to that you don't even know that you do. Ultimately, the biggest key to addressing visceral fat is looking. It's knowing if it's there. And so again, talk to your doctor about the possibility of getting an ultrasound of your abdomen or a CAT scan, or going to get a DEXA scan and asking your doctor to go over the results with you. And remember, just like weight gain doesn't happen overnight, visceral fat accumulation doesn't happen overnight either. And neither of those things, excess weight or visceral fat, are going to disappear overnight. But realizing that you are accumulating excess visceral fat is the first step in really addressing it. If you know it's there, you can start doing some things that move you in the direction of better health. Don't let another year go by without knowing whether you're accumulating visceral fat. It's very important, and it's something that you shouldn't ignore. Thanks for watching, and I'll see you in the next video.